out there in YouTube land. Dr. Reeves here for another neurology video. Today's video is about trying to combat sedation due to seizure medications. It's a common problem. Many medications, pretty much most if not all medications used for seizures can cause sedation. Having said that, understand that everybody's wired just a little bit differently. Every now and then you give a medicine that you would think should be sedating or could be sedating to a person, and they have a paradoxical opposite reaction. This has been described with many different medications over the years, so there's always the caveat of your mileage may vary. First, I want to talk about some non-medication and non-disease or condition-related issues. Then I'm going to talk about some not seizures, but other conditions that can be adding to the problem. And then I want to talk about the medications, of course, but I also want to talk at the end about some other medication approaches that are not commonly used to deal with sedation. So I have a couple tricks up my sleeve, so stay tuned. So for the non-medication side of things, there are some common sense things that one can do to reduce sedation when taking seizure medications. And I'll blast through them because it's a short list, but exercise is good for us in 100 different ways. One of them is increasing generally our feeling of having energy and not being sleepy. Sleep hygiene is a term used in medicine for being kind of taking good care of yourself and your sleep schedule. So if you're, for example, always waking up due to an alarm, then you're always sleep deprived every day, by definition, because your body wasn't done sleeping. So if you're staying up playing video games or watching YouTube videos until 1 o'clock in the morning and you have to be up at 6:30 and you're using an alarm to wake up, then you're sleep deprived every day. And that really isn't the medication's fault, the seizure medication's fault. So think about good sleep hygiene. You know, is it a restful environment? Is the dog jumping on the bed halfway through the night and waking you up after that? These kinds of things to think about. Another thing to look for, now we're on to diseases and conditions other than seizures that can cause problems. Obstructive sleep apnea is hardly rare, and as the United States and really the rest of the world seems to be getting heavier and heavier, the chances of developing sleep apnea are just going up. So if you're snoring yourself awake, or people say you snore loudly, or you hold your breath when you're sleeping, or your bed partner is always giving you the elbow because you're either snoring or you stop breathing, that would be an indication that you have sleep apnea perhaps, and you'd want to talk to your doctor about evaluation for that. Another sleep disorder is restless legs / periodic limb movements of sleep. They are not technically the same thing, but people who have one, almost all of them have the other. And that's when the legs are restless when you're sitting there or lying in bed, or when you're asleep, they're periodically twitching, and it kind of fragments your sleep, and you don't sleep efficiently, so you're tired in the day. So let's talk about the medications. There's no question that the older medications often are more sedating than the newer medications. That's been looked at by many researchers. We don't use barbiturates like phenobarbital very much anymore, but even the other ones that are older, like say Dilantin, phenytoin, and some other ones, can be more sedating than some of the newer ones. So a change in seizure medication is sometimes a good idea for sedation reasons or other reasons. Clearly, reducing the dose is not a bad idea for somebody who is maybe taking a higher dose than they really need to control their seizures. Another thing is sedation caused by medications that are kind of rapidly absorbed, and kind of the level goes up in the body kind of quickly. Say Depakote, for example, or some other medications where there's a regular form and there's a time-release form. With the time-release form, the peak in the body is lower. The trough tends to be higher. This correlates with seizure control. This correlates more with side effects generally. And so changing to a time-release form, if there's one available, can improve sedation for some people. vagal nerve stimulators, and I have a video on my channel about that, although the video is getting a little bit old. An electronic device placed under the collarbone on the left stimulates the vagal nerve in the neck, can reduce seizures in a reasonable number of people. It's not a medication, so it's not really sedating, and sometimes people can lower their seizure medications if they have a VNS in them. Your mileage may vary, but it is something to think about. Lastly, I want to talk about using stimulants to counteract seizure medication sedation. Now, I want to be very clear that when you're on drug A and it's causing a problem, the first solution should not be to try to add drug B on top of that. So, no question that if you're on a seizure medication or medications and there is sedation, the first order of business is to work with your neurologist to see if we can find a different dose or a different medication that provides you with seizure control that doesn't sedate you. So what I'm going to talk about is not the first line approach. I have experience in using stimulants in people who have seizure medication-induced sedation. I've done research on this and with my colleagues in the past. And this started with research using methylphenidate, which is marketed in the United States as Ritalin. And we found that it was actually really quite effective in reducing sedation and some thinking, slowed thinking in people taking seizure medications. There hasn't been a lot more research into that since my colleagues at Ohio State University did that research. I did see a more recent exploratory study done, but again, no one seems to be really taking that medication and looking really carefully at using it widely in people who have epilepsy. Having said that, I have over the years a fair number of times tried that with patients, and probably 70% of the time people find it fairly helpful. It doesn't usually take a large dose to reduce the sedation of the seizure medications. Another medication that I have experience with is Modafinil, marketed in the United States as Provigil. And yes, I know there are some kind of newer versions of the molecule, but basically they function the same way. I found that actually a fairly small dose of Modafinil taken in the morning is pretty helpful in reducing seizure medication sedation. When used for narcolepsy, the medication is often used in doses of 200 or 400 milligrams, maybe several times a day. I've found that in the morning, often 100 milligrams or sometimes 200 milligrams is enough to counteract the sedation from seizure medications, often with relatively few or no side effects. Again, your mileage may vary. You may talk to your doctor about something like this, give it a try. Usually when I'm working with a patient for something like this, I'll say, here's a prescription for 5 pills. And why don't you try this in the morning and let me know how it goes, because it's a small investment, you're not signing on for something, and if it works, you're going to know pretty much right away. Thanks for watching this far. Hopefully you can work with your neurologist or other physician to reduce sedation if that's a problem for you.